One of your primary interests is in preventing injuries among baseball players, and those players frequently have injuries like yourself to their elbow and also to their shoulder. Can you explain to us, I know one of your interests, and you've written about this, is Little League shoulder and also Little League elbow. Can you explain those two conditions?
Sure. Little League injuries, the injuries that we see in these younger kids are growth plate injuries. So there's a growth plate up at the shoulder, at the top end of the bone in the arm called the humerus, and then there are growth plates at the elbow. So the Little League injuries, Little League shoulder, Little League elbow, are injuries to the growth plates, and they're varying in severity, so they come in multiple types of severity. There's some really severe ones where the growth plate actually pulls loose and displaces from the piece of bone where it's supposed to be attached. Those are pretty obvious injuries, and they're not subtle, and people cannot continue to play because they're so painful, and an X-ray will show that the piece of bone is actually displaced from where it started. And in some cases, even in very young kids, you have to actually operate on these kids and put their growth plate back on where it belongs. More commonly, they get pain and they start to have pain with throwing, or more pain during the throw than after the throw. It's kind of a hard thing sometimes for folks, some coaches and parents, and all of us are involved in these things, to know what's normal soreness. If you're a pitcher and you go out and throw, you should probably have a little bit of soreness after you throw as you get up in years, but it's not okay to throw in pain. And so a lot of times what we see is that the kids, they just continue to throw and hurt while they're throwing. They can hurt at their shoulder, they can hurt at their elbow, and what they're actually hurting at is these growth plates that can easily pull loose, because those are, as I said earlier, the weak link in the chain. So the growth plates are weaker than the ligaments and the muscles and the tendons, and that's where the injuries occur in these kids.